We're reminded daily that we're part of a global community. Many times the news we hear almost nightly is economic news or political news, but we're also part of a global community in terms of health. Both the illnesses we have here and illnesses or conditions people have throughout the world are part of a global process of health and disease.
Globalization is a phenomenon that, as far as we can tell, is irreversible. It has accelerated very, very rapidly over the past decade. And even though it has very positive influences worldwide, it also poses very big challenges for global health.
In 40 years, we've pretty much looked to, we collect money from rich countries, we spend it in poor countries. I think today it's a much more level playing field. We recognize that even the countries where we traditionally had projects are countries where incredible resources exist. India is a case in point, the country where I come from. 80% of the drugs we use today to treat patients in our projects come from India. There are wide variety of resources that we can draw upon today to do our work. We have medical units in South Africa, we have medical units in Brazil, that they bring knowledge from these countries.
Globalization has also a profound connection with environmental problems like climate change. It also has a profound connection with what we refer to as epidemiological or nutrition transitions, whereby countries that formerly were mostly concerned with issues related to undernutrition are now as or even more concerned with issues related to overnutrition, to obesity.
I think we have both a moral and a scientific imperative to study health throughout the world. The moral imperative is because there are people in need throughout the world. What we know, our research, our innovation, practice, education can help those individuals. But just as scientists, we need to understand more about disease processes, risk factors, how to ameliorate the impact of disease throughout the world. An example we're reminded of almost continuously is avian flu H5N1 virus. To date, it has not infected a huge number of people, but by studying that, we may be able to either avoid animal to human transmission, poultry to human transmission, or we may be able to understand the disease so that we can prevent a broader global pandemic.
I think the more I travel, the more I realize that in all of these countries, people are pretty much the same. They have some of the same fears and they have some of the same hopes. I think once you focus on the commonalities, I think it becomes the common aspirations and the common hopes that people have. I think it makes it possible for us to have a dialogue